Like many of us, maybe you have some back pain or just some mild discomfort in your back out there. Maybe you've sought some help for that. Maybe you're looking either for a cure or at least something to manage it. I want to welcome in my guest this morning, Dr. Jason Highsmith. Actually specializes in this sort of thing. We're happy to have you on the show. Thanks so much for being here.
Thanks, Nick.
You actually wrote a book. We'll get to that in a second. But folks with back pain, I mean, just this past week, I had some back pain right back here. And it was not this mild thing where it was just bugging me for a few hours and then it went away. You know, I tried stretching, I tried doing all this. I eventually went to heat and alternated ice, and I wasn't sure, and I didn't read up on it to find out, but it seemed to help with some relief there. But you have some basic tips that you included in your book as well. Tell us about what your specialty is and where you're located and kind of how you help patients on a basic level.
Sure. Well, in North Charleston, I have a practice in neurosurgery, which we specialize in the surgical treatment of back pain. So it's when a patient has failed everything else. Most patients are going to benefit from all the things you mentioned: rest, ice, heat, alternating, just like you did. You did right on. We also recommend over-the-counter and non-steroidals like ibuprofen, Aleve, those type things. If those don't work and you're still having a lot of back pain for a couple of days, it's worth making an appointment with your primary care physician.
Sure.
They're the first place to start. And those are actually either physical therapy, chiropractors. We often send patients to yoga, Pilates classes, build core strengthening. There's a lot of things you can do to treat back pain once you have it, but more importantly to prevent it. A healthy lifestyle is probably the #1 way to prevent back pain.
So you mentioned that, and I find that interesting because most people don't understand that to strengthen those back muscles is so important. You say exercise is like a fundamental key to managing and being pain-free.
Absolutely, but unfortunately the exercises we all hate to do. It's the core. Crunches, sit-ups, and the horrible exercises that we don't like that make us look good, but that are hard to do. They're hard to get motivated to do in the gym. But those are some of the best exercises. Those are best done with a personal trainer or a therapist or someone that specializes in treating core strengthening rather than just someone going out on their own and trying to do 1,000 sit-ups to treat back pain.
We all have habits or maybe vices out there that aren't helping our health cause as well, whether it be dietary, whether it be smoking or something like that. There are some habits that we should possibly look at changing, perhaps, if we are dealing with a little bit of mild chronic back pain.
Absolutely. A lot of people don't know that smoking actually contributes a lot to back pain because just like it can degrade the skin and make people's skin very leathery, it degrades the disc as well. And so the cushion between the bones of the spine, the disc, the cartilage that helps us keep flexible and is a source of a lot of back pain, wears out faster in smokers. It actually dehydrates and degenerates and basically hardens, so you lose the flexibility, and that is a significant component of back pain that a lot of people don't realize.
Yeah, maintaining that fluid balance in your body, because your body is mostly water, is important no matter what you're doing. But certainly in that particular case, you want to keep that hydrated, you know,
Absolutely.
in that particular area. All right, so let's talk about the book. This is pretty cool. I know I can read this because of the title, okay? Complete Idiot's Guide to Back Pain, right there. So this is pretty cool because you wrote this with another author, and by the way, you're in North Charleston, you're a Charleston area guy, but this book is worldwide pretty much.
It is.
And that's pretty cool. That's a pretty cool accomplishment, but you co-wrote it, and the point of the book was to provide folks with mild relief that have, you know, problems that aren't as serious that need to see a neurosurgeon like yourself, right?
Absolutely. The book starts out with a description of the causes of back pain. So the most common cause, like you had the other day, probably is a strain or sprain. So the muscle, the ligaments get pulled a little bit, they get inflamed, they get irritated, inflammation. And that typically goes away in a few days. There's also other causes, congenital causes. Some people are born with a very narrow spinal canal, and they don't have a lot of flexibility and movement from birth. As we get older and everything stiffens up and you lose flexibility, those patients often progress toward back pain quicker. So there's a lot of congenital causes, a lot of degenerative causes, a lot of lifestyle factors that contribute, as well as, you know, poor things at work in terms of posture, ergonomics, standing up straight, all the things we know we should do, and we try to remind ourselves every day. But you know, we've all developed bad habits. We've developed leaning over to work on a laptop computer where the screen is down here rather than at eye level. We're often on our phones, holding it up to our ear while we try to drive or work on the computer. You know, even those little headset phones, although they don't look very cool, are certainly a good way to reduce neck pain and back pain. So there's a lot of things we can do, and the book sort of covers that. My co-author is a fitness expert out of Chicago who's a yoga Pilates instructor. And so the goal of the book is to cover everything from the most basic self-help things you can do to the most advanced treatments such as minimally invasive surgery, which in some patients is the right thing to do when everything else fails. So by coming at from these two angles, we sort of feel like we covered the breadth that includes acupuncture, physical therapy, chiropractors, pain management. All those people have a team, are part of the team rather, that actually contributes to treating back pain. So we recommend, again, going through your primary care physician, finding the network of providers that's going to get you the best relief. And certainly, hopefully, not everyone makes it up to the road of surgery, and that we don't expect them to. And that's what's good about this book, is that we cover all the other options.
Very neat. You can obviously find this in local bookstores in the area. And what would you say is a #1 assessment for folks who are struggling with some minor back pain? What's a question they need to ask themselves? Maybe something they need to reach for that may be non-pharmacological or pharmacological in your mind, without being able to actually assess that patient.
Sure, but if the pain's getting worse or they get weakness, they need to go to a physician or a primary care doctor quickly. It should not be something they put off if they're getting worse and worse in bed, becoming bedridden, a leg is dragging, or they lose something more valuable like bowel or bladder incontinence. Those are sort of emergencies.
Yeah, you're not driving to the bookstore at that point.
Right, you're not driving to the bookstore. Right. You're passing the bookstore, going straight to the ER if
Exactly.
you develop severe weakness or anything like that. The common strain, like you described, where you just ache and it twists and it's pretty sore, that typically goes away in a few days. If not, certainly need to seek medical help. There's other things that can cause back pain too. People don't realize that colitis or irritation of the bowels, angina or heart pain can actually cause back pain. Women with menstrual problems can actually have a lot of back pain from endometriosis. So there's a lot of other medical causes of back pain that aren't just the back, and it's important that we don't miss those.
Symptoms of underlying problems is basically what we're talking about, and it could suggest a more severe diagnosis. All right, Dr. Jason Highsmith is our guest. Check out his website, charlestonbrainandspine.com, or his phone number is 553-7615, correct?
Correct.
That's if you're having more serious problems, but check out his book as well, The Complete Idiot's Guide to Back Pain. Co-wrote it. He's located in the local area. His office is in North Charleston, and we appreciate having you on the show.
Thank you very much, Nick.
Thank you so much. Hey, remember, if you're having some back pain and you find some relief either by reading the book or seeing Dr. Highsmith, remember, you saw it right here on Port City.
What is WLCN? What is Port City? Hey, chances are, if you haven't heard of us, neither have your friends. Make sure you tell 2 friends for me right now. Tell them to watch Port City, weeknight, 6:30 p.m., and again the next morning at 10 a.m.